here. Ruggles here, MFA. Oh, MFA, we're here someplace.
Yeah. Well, that's a perfect segue. To Michael Fitzgerald. Welcome to Unplanned. Welcome to a new segment of Unplanned, which I haven't quite got a name for yet, but something like profiles or.
Okay.
And basically the premise is cool people in the Boston metro area who are doing interesting things, and you are profile number one.
Wow.
And
wow.
I guess I should say welcome back to Unplanned, because you actually gave us the rundown on a story you wrote in a prior journalism life, which we can get into. But it's great to have you back.
Yeah, I wrote about the history of America's best forgotten invention, the pipe wrench.
That's right.
For the Boston Globe magazine.
That's right.
And then I've left the Globe magazine and moved to take over Harvard Public Health.
Yeah. So, and that's why we wanted to have you here, because you're. How long have you been there?
So I've been there for just under 2.5 years. I joined in August of 2021 during the pandemic, and I came on board. They reached out to me. They were looking to, they being the school, Harvard Chan School of Public Health, Harvard T.H. Chan School of Public Health, because they wanted to sort of, they saw that journalism had been in decline, kind of information and news around the pandemic was very uneven, communications generally were problematic, and they thought, we have this vehicle that goes to our alumni magazine. Why don't we turn it into something more like MIT Technology Review, Harvard Business Review, which are university affiliated but editorially independent and are presenting ideas from not just those schools and the great thinkers at them, but from the world of business or technology, and in this case, public health.
So that's what you're doing basically, and you were hired specifically to kind of make that transition at that magazine, right?
Right, yeah, make it a more outward-facing publication, something that would be interesting to people who weren't alumni or faculty or staff of the School of Public Health, and maybe weren't even interested in going to the School of Public Health, but were interested in public health and wanted to give something authoritative, but also compelling narrative around public health stories.
Yeah, and so how's it been going? I mean, what's?
It's a lot of work turning something around.
Yeah.
It's really stimulating. Every day there's some new thing I need to learn or need to think about, and you just never. In journalism, your life is never dull. And fortunately for me, my life is not dull in ways that are often fun. And the way that we've had to do a lot of sort of thinking about what's the best way to present something like public health coming from us, from the School of Public Health, right? That is, you want to be aligned with a kind of broad vision of the world, and I think the School of Public Health had a vision that I found very attractive.
Oh, we're going to pause here for just a second, and we'll get this mic back on.
So, in one sense, the publication wants to reflect kind of the vision or mission of the publisher, in this case, the School of Public Health, and that's a mission that is to, improve well-being, health, equity, and better lifestyles for really the planet, right? Like big, bold vision. It's as a citizen of the world and a place. Like you want to be involved in something you think is going to make the world better. It gives you a sense of purpose every day. And so this is an opportunity to do that. And public health is something that I think, I'm not sure there are public health beats at papers or media outlets really before the pandemic. I mean, there are probably some specialized publications that had public health beats, but it's not something that we spend a lot of time thinking about as a day-to-day thing.
Well, let's dig into it a little bit. So you got this new job,
right.
And you're before you were at the Boston Globe, right? And you were writing a sort of general beat. I think you were.
We're as general interest as you can get, with a focus really on the Boston area. And I was at the Boston Globe magazine. So we were. That comes out weekly in the Sunday paper. and obviously it's online during the week. But newspapers are information buffets.
So then you get this new job,
Right.
and you clearly have a public health beat of some kind.
Right.
It's actually interesting that, of course, you mentioned COVID, right? COVID has got to be one of the great public health issues of the last century, probably.
Indeed.
And so, how did you take your prior knowledge, experience, know-how, and apply it to your new understanding?
Well, a lot of it was, how do you tell complicated stories in a way that people might spend some time with and want to read?
Right.
So you're looking for a subject who is going to be compelling. People are very interested. We are very interested in seeing how people resolve problems. We want to we want to learn about things in a new way. We want to have interesting conversations. We want to see what someone else's view of the world is. And we want to sort of compare it to what we think ourselves. So as an editor, you're trying to think about what's the best thing I can do for my reader to let them help them understand something that's complicated. And public health is often very complicated.
Well, let's dig in. Let's take that as a lead to dig into some of the stories that you shared with me, a whole bunch of stories that are relevant to cities. You know that Unplanned is about cities.
Right.
Public health obviously has a deep urban component to it, and you're based in Boston. You're based, as we were saying, right down here in Boston. Let's take a couple of the stories that you sent over to me just to look at. One of which that comes to mind immediately is your story about murals, which I found, I personally, and I'm not sure why I find this so interesting, but it is so interesting to me, the question about murals and I guess how they impact public health, right? Yeah.
And you would think, well, how does a mural impact public health?
Right.
How does it make you feel better? Change health outcomes. And so the thing with public health and with what I had to try to figure out how to do to tell stories is I came in thinking, we'll just tell big, long stories that have a complicated narrative, and I'll find certain kinds of writers, and we have the time to put into editing these things, and that'll be great. And then you realize that to make health outcomes change, to improve them, you don't just have one lever you got to pull. You've got to pull a whole bunch of levers. And so one thing that you can do in a community, if you want to make people feel better about their lives, it turns out, and we found a study that had been done about a mural project in Philadelphia, an ongoing mural project. They've done scores of murals across the city. And what the study found was, and they put them in all different kinds of neighborhoods, but they were studying like what's the impact on people's lives in a neighborhood that had kind of demographic data that suggested that this zip code was was lower income, had more unemployment, more sort of data around things that like we know depress health outcomes, like shorten lifespans. On average, people have more health issues in neighborhoods of this sort, right? So they studied what happened when some murals were put into certain places in that area, right? And it turns out that over time, people felt better about their environment, they felt better about their lives, and that you could sort of statistically tie part of this to the impact of the mural. So does the mural make them live longer? Not saying that. Does the mural make them less likely to get certain diseases? Not saying that necessarily, right? But what they did see was that on a day-to-day basis, from a kind of living in the world, how's my level of stress, how's my mental health, if you will, my well-being, sense of well-being, those numbers went up. And we only did this looking at this particular study in one place, but it does sort of mesh with other things that I have seen or written about. And I should say, I was not what you would say a public health reporter or journalist. That wasn't my area. I did a lot of tech, a lot of innovation, and then the general interest world of the globe. And yet, in my career, I've done a lot of stories that actually tie to health impact and health outcomes for communities, right? Public health, not being like you or me in our individual health, but looking at the aggregate data for a community, a zip code, a city, a region, right?
One other story I want to just touch on, which I found just so impactful. There are a lot of stories that you sent, and they're wonderful stories throughout the magazine. was a story about Milwaukee. And what I took away from that was a story about food deserts where there is no healthy food in an urban area in Milwaukee. I know that wasn't the only component of that story,
Right.
but it was just very impactful. Somehow
Yeah.
it just really hit home.
And that story was part of a package that we did. We wanted to look at the challenges of structural racism on health outcomes. And there are studies that have been done that do specifically look at what do sort of built-in pieces of structural racism. And so you can look, for instance, at look at neighborhoods that were redlined or historically redlined when it was legal to discriminate based on race in terms of giving out mortgages or letting people move into certain neighborhoods, right? So studies have been done saying, okay, we can see there's a difference in lifespan, there's a difference in certain kinds of chronic disease rates, right? And the numbers are negative for the people who live in these areas. Most of whom are not white people. They are mostly black people or people of color. And so we we wanted to look at the whole kind of gamut of how does that play out. And so we ended up doing like 5 different stories, looking at the science. So we say, here's our scientific evidence. Here's the basis of why we're doing this issue. And then we wanted to look at what that means, what the impact was, and we found we had a writer go out and he found really like one of the I think it was the poorest zip code in America, and it was in a place that had been in a redlined area, neighborhood. It happened to be in Milwaukee, and so he did a piece. He found a person who grew up in the neighborhood, had kids in the neighborhood, was an activist in the neighborhood. In part because she had grown up and become, in fact, she had high levels, she was obese, she had diabetes, I think, she had a few other chronic health issues, all of which map with the kind of statistics that we were seeing in some of the scientific studies. And we wanted to tell a story of what it's like to live in one of these neighborhoods day to day, and with the health, with individual health as part of that, but in the broader context of this is what you see on an aggregate level. This person is kind of a prism for that. She is in these statistical slices. This is what this person would look like. The reason, and yet, despite all of these things, she was an activist. She was working and involved in a number of projects, including a playground project, but were meant to make this neighborhood more livable. And the food desert aspect was one of the things that she and other activists in the neighborhood were really pushing for. How do we get better, healthier food that we have regular access to, when we don't necessarily have cars or the public transit isn't working very well, but that's what we have. Like, how do we work this out to make this a more livable neighborhood for the people who are here now?
What's next for the magazine? Where are you going? Where are you trying to go?
Yeah, so we totally relaunched. We're really digitally focused now, and we are basically trying to just get the word out about who we are, get people paying to see us. Our goal is, our tagline is we look at what works, what doesn't, and why in the public health context. So we're trying to just do more stories. So the bigger we can get, the more attention we can get from people, the more interest we get in the journalism that we're doing. The approach we're taking to telling stories. And we think public health is so broad, Sam, it's so vast. It goes from bench science to, people working in utilities that we picked journalism as a way to approach stories because that forces us to try to tell a story that is accessible to anybody who wants to read it. We don't want to assume you have a certain level of scientific knowledge or that you have a master's in public health. We want to make sure that the information is clear. And if you just were a random member of the public, wanted to learn about some issue in public health, if you came to our stories, you saw them, you would come away with an understanding of it. And in particular, what we're looking at are solutions. Like there's a lot of persistent long-term problems in public health that, where the numbers just don't change in certain groups for decade after decade after decade. We are really focused on trying to find people who are trying new things that could change these outcomes, make them better, or ideas that people are putting out there to say, let's try this. So this is really the focus that we have.
Well, it's all fascinating, and Michael, I just want to thank you for coming by and being our first profile. For the people who are watching this video, if they want to go and see your magazine, find out more about it, find out more about you, contact you, get involved in some way, where do they go? How do they reach you?
Yeah, so I'm just going to pull this up on my phone
Sure.
and show it to the camera. So this is harvardpublichealth.org, O-R-G, not edu, harvardpublichealth.org. You go there, you type it in. We have, you can see our pages here. If you want to get weekly updates, we've got a newsletter page where you can subscribe to. You push a button, subscribe to it, harvardpublichealth.org/subscribe. But you fill in your name and your email, and you can get it every week in your mailbox, in your email box. And you can find us on social as well. We're at Public Health Mag on Twitter and LinkedIn and Instagram/Facebook. So that's us.
Great. Well, Michael, we just welcome you back on Unplanned. We look forward to getting you back on. Maybe we can dig more deeply into one of these stories and really go out and maybe do some field research ourselves with a camera. That would be fascinating. But thanks again, and I'm glad we had a chance to introduce you to everybody who's an Unplanned viewer. So.
Well, thank you, Sam. It was great fun to be here, and look forward to doing some more with you down the road.